Hi, my name is Shaylee Marshall, and today I'm going to be performing my NG tube insertion video. Before I begin, I'm going to perform my GPSP, do my 11 rights and 3 checks. I'm also just going to check the patient's identification band, make sure their name and date of birth matches, and just to be on the safe side, I'm also going to assess them for allergies. Then I'm going to grab my tube and I'm just going to get my measurement. So I'm going to go from the nose to the earlobe and then down to the xiphoid process. Once I've got that one, I'm going to add 10 centimeters to it. And then I'm going to mark it with a piece of tape or a marker. Okay, just put that back down. I'm going to perform some hand hygiene and put on a pair of gloves. I'm going to take my tube again, lubricate it about 2 to 4 inches. I'm going to have the patient in a high Fowler's position, sitting upright, and I'm going to have them flex their head back. I'm going to insert the tube slowly into the nostril. Once it has reached the pharynx, I'm going to have the patient put their chin to chest and have them swallow as I advance the tube. I'm also making sure I'm not letting go of the tube the entire time, and I'm just going to advance it to the original mark that I made. Okay, once I'm at that mark, I'm going to loosely secure it with a piece of tape. I would also assess the patient to make sure that they didn't have any signs or symptoms of distress, and if they would, I would discontinue the procedure immediately. So after that's loosely secured, I am also then going to check for placement. I'm going to get a chest x-ray, and I'm also going to test the pH. So to test the pH, I'm going to grab my syringe, and I'm going to aspirate a small amount of gastric content. Check the color of that, make sure it's good. Put that in here. Then I'm going to grab my pH test strip and test the pH of the gastric content, make sure it's within good range. Once I've done that, I'm going to take off this temporary piece of tape, making sure I'm not letting go of the tube, and apply and completely secure it with another piece of tape. Once that's completely secured, I'm then going to measure the exposed tube. I'm going to measure from the tip of the nose to the end of the exposed tube. And I'm going to note that measurement in my documentation. Okay, once I've done that, I'm then going to secure the vent above the stomach. Just going to attach it to their gown here. And then per the order, I would either recap it or hook it up to suction. I'm going to hook this up to low flow suction over here, turn it on, all that good stuff. Once that's done and that's going appropriately, I'm going to assess my patient, make sure they're doing okay, and then I would come back and reevaluate them in an appropriate amount of time. I'm going to take my gloves off, perform my hand hygiene, and immediately document and record.